Let's talk about coxal bones, our bones of the pelvis. Each one of these bones is referred to as a coxal bone. Okay, so you've got two coxal bones, you've got a left and a right, and together articulating with the sacrum, as well as the coccyx, which would be on the inferior aspect of the sacrum, I don't have one with me, would comprise the pelvis. So let's look at the coxal bones. It is going to be very important to be able to tell left from right on coxal bones, as well as anterior from posterior. So a couple things that we can look at here. This socket is the acetabulum, and this is where the head of the femur is going to articulate to form your hip joint. So acetabulum is always going to face lateral so that the head of the femur can come up, and it angles medially so that they can meet up. Also, we've got this ilium part of the coxal bone, and this particular landmark is called the iliac crest. So this part here is always going to face superior. Okay, so it's always going to be the top part. If we look at these bony prominences on the inferior aspect, we see a more rounded bony prominence. This is going to be more posterior. This is part of the ischium, which is one of the three bones that comprise the coxal bone. And this particular landmark is called the ischial tuberosity. So this is the, we call these your sit bones. These are the bones that you sit on. And if we look a little more anterior in the pubis area, this is the pubis bone, which is the third bone that comprises the coxal bone. This is a little more angular, and you have this articular space here that's going to articulate with the pubis bone on the other coxal bone to create your pubic symphysis, which is going to be the anterior joint of your pelvis. Okay, so that's how we can tell top. Lateral acetabulum is always going to point laterally. Pubis is always going to point anterior and medial, and then rounded ischial tuberosities are always going to be posterior. So as a result, this would be a left coxal bone. Okay, and it would join up with the right coxal bone here, creating pubic symphysis anteriorly, and then they would articulate with the sacrum posteriorly. So they would look something like that. Okay, so forming your pelvis. So we can talk about a few landmarks here. If we follow iliac crest anteriorly, we're going to see these bony prominences here. And the first bony prominence you come to is anterior superior iliac spine. Okay, and if we go just below that, the next bony prominence is anterior inferior iliac spine. Okay. If we look on the posterior aspect of the ilium, this part here, this is called the articular surface. And again, this is the part that's going to articulate with the lateral aspect of the sacrum to form the sacroiliac joint. So if we continue along the top of the ilium here, we're going to get to this bony prominence. And this is the posterior superior iliac spine. And just below that is posterior inferior iliac spine. Okay. Continuing along this posterior margin is this large indention, and this is the greater sciatic notch. Then we come down to this small bony projection. This is ischial spine. And then just underneath ischial spine is going to be the lesser sciatic notch. And then we're back down again to ischial tuberosities. So again, large, rounded, bony prominence that you sit on. Okay. Another landmark that we can see in the pelvis is there's a little line that you can follow from the articular surface, and it's going to head down into the pubis area. But this part of the line right here is called the arcuate line. That's the arcuate line there.